Hello, my name is MarkAlain Déry. I'm an infectious diseases physician and epidemiologist here in New Orleans, Louisiana. Despite significant progress in HIV prevention and treatment, disparities persist across different populations. This roundtable that we are going to have today brings together distinguished HIV experts and stakeholders to examine the complex factors driving these inequities and explore strategies to promote health equity. By fostering open dialogue and collaboration, we aim to identify actionable steps to address HIV disparities and ensure access to quality care for all affected communities. The insights and perspectives that our experts will provide here today will be invaluable in shaping a more just and inclusive response to the HIV epidemic. And with that, let me please introduce our panelists today. First up, Dr. Sneha Jacob is an associate professor of medicine at Rutgers University, Robert Wood Johnson Medical School, as well as an HIV specialist with a background in internal medicine. And Dr. Hamadullah Shaik is an assistant professor in infectious diseases at Rutgers University, Robert Wood Johnson Medical School, and is associate chair for infection prevention at Robert Wood Johnson. Please, let's give our panelists a warm welcome. All right, our bonus question is climate change and infectious diseases. So for me, I am thinking a lot about climate change. I'm thinking a lot about infectious diseases. I'm thinking a lot about H5N1. I'm thinking a lot about this death that happened in Mexico with an H5N2 organism that the person had no access or was just, should not have been at risk for this, that did not work on a farm or what have you. So I'll just say real quick, for me, thinking about just focusing on HIV, but, obviously there's so many other ways to go. A few years ago in northern Siberia, there was a village where a mammal thawed. It was a deer, an ancient deer that thawed, and the village used it for meat, not realizing that this had been a thought out, and it had Bacillus anthracis in it. And there were 70 people who got infected with anthrax, and I think several deaths as a result of that. So we are seeing now organisms and these ancient viruses, or in this case, obviously bacteria, but these ancient organisms that could surface again. So for me, I see issues regarding population migrations that could be potentially disruptive of people living with HIV. I see food insecurity. I see just mental health issues when I think about specifically climate change and HIV. And so I just am leaving it as an open. I'm asking my colleagues these questions regularly just to hear what they have to say. So Dr. Jacob, I would just love to hear what your thoughts are on this.
When I think of climate change, I think of global warming and the temperatures, and the many individuals and even largely outside the United States who are living in extreme circumstances, whether it's extreme heat. I know that in Delhi, the temperature reached 120 degrees, which was a record recently. And I recently met someone in the School of Public Health here at Rutgers who has been looking at how do we do simple things, low cost for communities that are vulnerable, that don't have air conditioning? How do we reduce heat? And they were looking at reflective coatings on homes, and to even reduce the temperature by 5 degrees, looking at the impact on blood pressure, on stress, because if we think about it, people who are living without air conditioning, who are living in these temperatures, the amount of stress that impacts them emotionally, right? Not just physically with blood pressure. So I think these are all things that, they're outside the US, but they could even be present, in different parts of the US, right? I know, especially in the South where Dr. Déry is, it's much more evident with these extreme temperatures. And so the lack of access to those basic necessities in homes, whether it is air conditioning, a form of cooling, ventilation, I think it is part and parcel of somebody's health and somebody's well-being. And so it is an important area that we should be privy to, especially in this day and age.
Thank you so much. And Dr. Shaik.
Yeah, when it comes to climate change, we've already been seeing some diseases resurface, right? I mean, we had the scare about polio in New York. We had the measles outbreak that's been going on. And I think, a major part of it has to do with mass immigration, especially people who are coming in from places where, the vaccination uptake is low and where, they don't even know about their own diagnoses. That's always a problem. Other than that, just the whole the one thing that you mentioned is the security of the food, right? Their own security and the security of the food. I think that always has to do with how we deal with these patients. Um, I haven't practiced a lot in this country yet, but I think over time, what I have seen is just the whole the medical infrastructure, right? And sometimes it's just very difficult to get care, right? I mean, that has to do with how these patients are treated. That has to really do how quickly they can get into some treatment plan or anything or something like that. So I think a lot of the things that go in here, but with just regards to global warming and how it affects HIV, I'm not too sure about that. But some of the things that can contribute with that, I think, are included under the general umbrella term of climate change is the immigration and the food and just the whole infrastructure of the medical system.
Yeah, and and thank you guys. I know that was an unplanned question, and thank you so much for answering those. I will say I've been in New Orleans for 20 years, and so Katrina to most recently Hurricane Ida, and how disruptive these storms are. And thankfully, practicing within the Ryan White system, we were able to get our project officer on the phone immediately in DC. And one of the things that they did was, and this, I think, you'll see this, and if you wonder, if you get this email, Dr. Jacob, as to why all of a sudden are you getting an email like this, it emanated from our clinic system as we were trying to figure out how to get people who left New Orleans or left Louisiana who needed their Biktarvy or needed their medications. How were they going to get it in Texas, in Arkansas, in Mississippi, or wherever the places that are all around us? So what happened was that a edict came down from the Ryan White, from HRSA, that said, if somebody with HIV comes to your Ryan White clinic, no questions asked, you dispense the medications they need. And so that again is this issue of removing barriers. And so that's how we were able to get our individuals the medications they needed. But it was from that perspective, climate change is very disruptive in medication delivery as well. And so that's something that is very, very problematic for me. We talked about migrations, we talked about food insecurities, whatever, but just seeing Katrina, and then the multiple storms, but the two big ones were Katrina and Hurricane Ida, that coincidentally happened exactly to the day on the 19th anniversary of Hurricane Katrina was Hurricane Ida. But they are very disruptive, and people don't have medications. When they leave, sometimes they just leave with whatever they have on them, and they leave their medications or their dot bag at home or what have you, and it becomes very problematic.